the appointed time, and we have a quorum. So I call this meeting to order. No minutes to be confirmed, and since the last meeting, no information paper has been issued. So if there are no other views, items for discussion at the next meeting, I'll invite Secretary and his team to come in first. And list of outstanding items for discussion and list of follow-up actions have been circulated to members. The date of the next meeting will be the 20th of May 2013, 4:30 p.m. Before the next meeting, Dr. Kwok Ha-ki has suggested a discussion on the regulation of healthcare intermediary service. It has been scheduled for discussion next time, and their deputations will also be invited to give their comments. And the administration has proposed to discuss the commissioning of the North Lantau Hospital Phase 1 at the next meeting in May. So far we have two items proposed, one on regulating healthcare intermediary service and the other on commissioning of the North Lantau Hospital Phase 1. Any other views from members? If there are no other views, and if there are no other proposed items for the time being, then these two will be the items for our discussion at the next meeting. You may give further suggestions to the Secretariat later. Third item on the agenda, establishment of Center of Excellence in Paediatrics. The administration's paper and the electrical brief have been circulated to members. This is a funding proposal, so may I remind members to note Rule 83A of the Rules of Procedure in relation to the Declaration of Interest. At the meeting, members may not move any motion or propose any amendment where there are direct or indirect pecuniary interest, or speak on the matter unless the member discloses the nature of the relevant interest. So may I remind members, if there are direct or indirect pecuniary interests in relation to this item, please disclose the nature of this interest before you speak. May I now invite Secretary to walk us through the paper first. Thank you, Chairman, members. This paper updates members on the development of the Center of Excellence in Paediatrics, CEP, including the scope of the project and the estimated cost. With members' support, the funding proposal will be submitted to FC for approval. Last March, in relation to the CEP, we consulted the Health Services Panel, and panel members overall supported the proposal. The proposed CEP will be a public hospital under HA, and the management and administrative support will be given by Kowloon Central Cluster. In relation to the service model and the scope, we have already we have a plan in mind, and this hospital will concentrate low volume high complexity cases for tertiary care for adolescents and children up to 18 years old, and it will also promote and advance exchange of professional knowledge, and there will be medical research and professional training. There will be certain adjustments to pediatric services in public hospitals. They will be reorganized into a hub and spoke model, which will help to link up community care, primary, secondary, and tertiary pediatric services more effectively, thereby establishing a well-coordinated and connected pediatric service network. The RCSD has completed the preparatory work, and the tendering process has already started since last year. And the estimated project cost is $13 billion in money of the day prices. Subject to FC's approval, the works will commence in September 2013 for completion by the middle of 2017. So much for my presentation. I'm happy to take questions from members. We have members who have raised their hands, 8 of them. Joseph Lee, Fernando Zhang, and others. 4 minutes for 8 members, 32 minutes. So first member, Dr. Joseph Lee. Thank you, Chairman. This is for our discussion. The funding proposal involves $13 billion. So basically, it is good to have the CEP, but about the hub and spoke model, as mentioned in the paper, I'd like the administration to explain about it. Does it mean that the after reorganization, the tertiary and secondary services will be duplicating resources because there are pediatric units in public hospitals? So first of all, will there be duplication of resources? And second question, this center will provide medical research as well as clinical services for complex cases. So my question is, what is the percentage of the so-called complex cases at present, so that we need to build a $13 billion center? And can it be achieved in future? My third question is, NICU is a flashpoint. Now, about manpower, upon completion in 2017, can the administration guarantee that there will be sufficient manpower for the provision of such services? Another question, private hospitals, will they take cases on a private basis? Secretary. Well, I'll say something about principles, and then I'll defer to HA colleagues to explain a little bit more details. The first question asked by Dr. Joseph Lee about duplication of resources. This is also a major concern of the administration and the hospital authority. Well, for a medical center like this, on the one hand, we need to concentrate high complexity cases, but on the other hand, general services are also required at the district level, and it is important to avoid duplication of resources. What I can tell you now is about principles. For the actual circumstances, you need to look at different specialty services at district hospitals and the interconnected specialty services in the hospitals. We need to discuss the details before we can tell you the concrete arrangement. Definitely, the university and the private sector will definitely play a role in the center, but this center is basically a public hospital. Maybe I'll defer to Dr. Zhang to say more about that. The role of the university is very important because apart from clinical services, the center also provides medical research and professional training. So we're going to work with the Medical College of the Hong Kong U and the Chinese University of Hong Kong in this regard, and there will be elements of medical research. NICU, basically, it will concentrate complexity cases which require intensive care. For NICU, it provides intensive care for newborn babies, whereas we also have a special baby care unit for babies, and there is a multidisciplinary approach requiring different treatment and services, for example, cancer and radiology services. I'll defer to Dr. Lee to say more about the services. The Center of Excellence in Pediatrics deals with complex cases. There won't be a high volume of cases, but for example, oncology department for children, well, this is a major department. There'll be more than 100 cases. The cases might not be a great in number, but a cross-disciplinary approach is required, including surgical, pediatric unit, and other departments. For example, there are inherent heart diseases, and per year we have 200 or 300 cases. For major operations, according to HA's statistics, we have around 5,000 pediatric cases per year, and basically this will be concentrated in CEP. will private cases be taken up? We will look at the HA's existing system. Under the existing system, we have around 30 hospital beds for private cases. Next, Dr. Fernando Zhang. Thank you, Chairman. This children's hospital, the Center of Excellence in Pediatrics, will face a number of challenges. One is competition. If it becomes one of the hospitals under the hospital authority, we already have pediatric departments in 13 public hospitals. Why should they give up their own cases for referral to CEP? Will there be competition in relation to manpower and resources? The other point is about competition between the public and private sectors. For private practitioners that have taken up complex cases, the private doctors might stand to benefit if they treat the patients rather than referring those cases to CEP. So how can the situation be improved under your proposal? Apart from university professors, not many private doctors are interested in those cases under the existing system. The third point is that you say there is exchange on a professional level. You say that this is a home-like, child-friendly environment. But for children's hospital like this, the environment is much better than a traditional hospital for children. If you adopt the conventional management approach of the HA, how can you meet these three challenges so that it really is a center of excellence?
Yes. Mr. Secretary, I will try to answer, and then Dr. Cheung can supplement. Now, on competition, Dr. Cheung is right. We do face those problems. Now, regarding manpower, why would the other hospitals give up their patients and provide manpower? And also, how about private doctors? Now, why did the government initially accept this proposal for a Center of Excellence for Pediatrics? It was on the basis that pediatric specialists in Hong Kong and other specialists involved in high-level pediatric cases agree that we should pool the resources so that there would be a better effect in treatment. Now, I've been in contact with pediatrists, and they have a strong ideal concerning this proposal. I'm sorry, Mr. Secretary, I understand that zeal and ideal are important, but you must have a good system. Now, for the governance of this Center of Excellence, the board of directors, the management structure, how does it compare with the usual practice within the hospital authority? How does it overcome the three challenges? I'm sorry, Dr. Cheung, you haven't mentioned governance just now, but in any case, this is very important because, firstly, in this specialty, people share the same wish, so we get all the specialists to sit together on how to arrange for the support and then impose a governance structure. And I can't tell you that we have already achieved that because we have to discuss how to arrange the services and how to impose a governance structure. That is, you don't have a plan yet. And now, not the specifics yet. Mr. Poon Siu Ping. Now, I support the Paediatrics Hospital. Now, it will be completed in 2017. I'd like to follow up on the questions. Now, firstly, I see that in the future, for cases referred by both public and private hospitals, they will all be handled at this center. Now, because there will be question of different charges. Also, there will be a shortage of manpower. Right now, there's already very tight manpower resources at public hospitals. So how can you ensure enough manpower at this center? And for those under 18, these are the subjects, the special, those are serious cases in this age group that will be focused on. Now, what's the standard of complexity? How do you draw the line? Now, on the principle, now regarding quality, even for other public hospitals right now, there are both public and private beds, but the overall principle is that the same quality of treatment is offered, but the space, might be a bit more copious, more comfortable. Now, right now, the pediatrics specialty is relatively tight in terms of resources. So in the coming couple of years, we will try to fill in the gap, and some staff will have to come from other centers. So it will not be simple now, but it will be a few years before the hospital is completed. We try to make up for the deficiency within this period. Now, on the definition of complex cases, Dr. Lee, please, from the point of view of a clinician. Now, on the complexity thereof, now in each specialty, we have a certain standard of judgment. Now, especially in particular in the past 2 or 3 years, when we were making preparations for this center, we have conducted a lot of discussion. We now have a initial framework to determine who would be admitted to the CEP and which cases would be treated at the other hospitals. Now, this is also available, this standard is also available in other parts of the world. No specifics, again. So you say that you have, but you don't have the specifics. Now, let me add to this. Now, within the pediatrics, there are other subspecialties. For instance, in in certain cases, in the respiratory diseases, the simple cases would be dealt with in other cluster hospitals, but for some very serious cases, it's difficult to say what they are, but we can determine which are more serious. Now, I'll tell you something from my experience, Dr. Ko. Now, at Prince of Wales, there was a child who developed a liver cancer, and then the pediatric surgery professor had to get a doctor who dealt with cancer, liver cancer for adults. Now, so how do you ensure that you get the required specialists. Now, for cross-disciplinary cooperation, we talked about that already. Now, on where it's to be done, we can talk about that, because the specialists can travel from one hospital to another, so it's not just one hospital that's capable. Mr. Cheng Hang Ben, now we look forward to this children's hospital, and we hope that it can serve the young generation. Now, many parents, when their children are ill, they want to get the best treatment and care for them. So in general, we support the construction of this children's hospital, but I'd like to get some more information from the administration. Now, this hospital will mainly deal with referred cases of a tertiary nature. Now, who will initiate this? Is it the cluster hospitals, or is it determined by the center itself? Now, and can you tell us more about the operations? Now, this center will also have private beds. Now, on referred cases, will they be charged at private rates or public rates? Now, for some private hospitals, when the cases get complex, they refer them to the public hospitals. So in future, the cases referred to by private hospitals, will they come directly to the CEP or to other hospitals? Or would there be another hurdle? And what charges would they have to pay? Now, would there be a selection mechanism based on the amount? Now, on the guidelines for the referral, now the specialty and specialists in one hospital have to reach agreement with those in the other center. So before the center operates, we will already have agreed on the guidelines. So we will work on that, on the basis of those guidelines. Right, but we don't have the guidelines now. Now, for private cases, there are two approaches. In some cases, according to the guidelines, they may be directly referred to the pediatric hospital. Maybe Dr. Lee can elaborate on whether we need a selection mechanism for cases referred to from outside the system. Now, would it be selective, or if time permits, would other specialists take a look to decide first? Dr. Chiang? Now, basically, it's an interactive system. Now, this case looks at tertiary cases, so it won't. We won't have patients directly come to the hospital. There would be a referral process. So pediatrics at other hospitals can do it. For private hospitals and private doctors, they can also refer cases. As the secretary said, there will be guidelines. Now, when we have accumulated some experience based on communications, we will try to improve the guidelines. Now, right now, this will be a hospital under the hospital authority, so we will follow the gazetted levels of tariffs or charges. Now, will there be room for amendment later on? We can explore that. There is still time, but it will be a transparent system. Dr. Lee, you have something to add? No. Next, Ms. Mack. I support very much the construction of such a center. Now, we may not see the problems that clearly yet, but if we don't have such a hospital, given our low birth rate, now the there are fewer babies, there will be fewer and fewer cases for pediatrics in outlying centers, outlying hospitals. If we have such a center, it will be more centralized, and I think that's good. Now, it depends on what sort of cases are handled at this center. So, will the other clusters and the hospitals take so many cases that there are not sufficient cases for this center? Now, if we want to centralize resources, if you want to cut down on the caseload of the clusters, there would be pressure. Now, how would the HA deal with that? Now, of course, just for the support of this hospital, the HA may not want to cut the resources for the other cluster hospitals. So, but again, however, on the other hand, you need sufficient number of cases at this center.
And you need necessary resources to procure equipment and facilities for this center. And I think from overseas experience, there should be resources from the community or from private sector in order for the center to operate. So how can funds be raised in the private sector? Secretary, I'll defer to Dr. Zhang to take this question. Dr. Zhang, please. Now, as mentioned by the member just now, in relation to competition with the private sector, on the whole, we'd like to concentrate complex cases for referral to the center. For example, for cardiac surgery, surgical departments, and oncology, etc., our specialists will concentrate in the center. We have tertiary pediatric services, and those specialists will also be transferred to the center as well. But they are still interconnected with the hospital departments. These doctors might still visit the hospitals to take up cases. So it's more of a network. We think this is feasible because, as members may know, with the CEP, apart from specialists, we also have special services and facilities. With concentrated resources, we can provide special facilities, and patients will stand to benefit. But there is still a degree of participation from public hospitals. After the cases have been referred to the center, they can still take part in these cases. Resources from the community. Of course, we welcome community's participation. We welcome any fundraising exercise as well as donation from private sector. Next, Mr. Zhang Kwok-chi. Thank you, Chairman. On resources, I'd like to know more because referral is necessary according to your proposal. So unless we require all tertiary cases from public hospitals to be referred to the center, there is a question of how the cases can be referred when the public hospitals can treat those cases. And how many cases will be referred to the center? The third question is whether there is any element of Western and Chinese medicine. This is a new idea. The combination of the Western and Chinese medicine is already being considered by mainland hospitals. Secretary, on case referrals, as mentioned by Dr. Zhang, participation is very important. Other centers or other hospitals of HA, after referring the cases to the center, if those doctors no longer play a part in the treatment of those cases, then it seems quite meaningless. So inevitably, when the cases are transferred to the center, the resources would also follow. But under this mechanism, they can still have a certain degree of participation in those cases. They might take turns, for example, or with different levels of participation, and we can consider that further. A mix of Western and Chinese medicine, it is also very important. But the Center of Excellence in Pediatrics is already a new idea. So at the initial stage, I think we will first deal with the integration of pediatric services. We will coordinate services from the oncology, radiology, and the surgical departments, etc. first. We're open to this idea, but this will not happen at the very first stage. Any follow-up? Thank you, Secretary. Children is our next generation. Now, this is a good idea to have a center of excellence in pediatrics. But what about senior citizens? Will there be a center for senior citizens, Secretary? Of course, since Mr. Cheung asked this question, I think he's referring to a center of excellence in geriatrics of this standard and of this level. I will be quite prudent for HA to operate such a center. We need to make this work first. In the past, apart from the Center of Excellence in Pediatrics, another proposal was also floated in relation to the other disciplinary, but the progress has not been as good as the CEP, but we still have this concept in mind in considering further hospital development. But first of all, we need to do this properly first and see whether this concept can be fully implemented. Dr. Elizabeth Quart, I'd like to ask about manpower and the babies born to non-local parents. Well, we understand that the hospitals are experiencing a manpower shortage. I don't know quite sure whether this is happening to pediatric departments as well, but my question is with the commissioning of the CEP, whether the other public hospitals will experience a tighter manpower shortage. If you don't have a breakdown today, I hope you can provide the data after the meeting. The other question is about type 2 babies born to non-local parents. Now those babies have reached the school age, and there is a shortage of school places in North District. Have you assessed the impact of those babies on the demand for this center? Will this induce a greater demand for babies to cross the border to seek treatment, and thereby affecting the services provided to local people? Secretary. As I said just now in replying to another question, pediatric services at present is one of the specialty experiencing quite serious manpower shortage. So if we reorganize the services, there will be impact on manpower as a whole, and therefore, before the commissioning of the CEP, within these few years, we need to make up for the shortfall. About type 2 babies, in general, they will cause a greater demand on our service, And we are assessing the manpower in the healthcare sector. We have a steering committee. One of the tasks of the steering committee is that we have commissioned the Hong Kong Youth Public Health Institute to come up with a tool for assessment so that we can consider demographic changes and changes in demand so as to come up with a model that can more accurately assess manpower needs. As for type 2 babies or other babies seeking treatment in the center, now before the zero quota system, these babies born to non-local parents have already got a right of abode. They are part of the Hong Kong population. So we need to take that into consideration. Not all of them will go to the CEP, but some of them will go to CEP. But we adhere to our principle, and that is we accord priority to local patients. You still have time? Yes. Now, Secretary just said that within these few years before commissioning of the center, he will consider how the manpower shortage can be made up for. Will that include more training? I don't just consider. This definitely will be done. On the one hand, we try to retain manpower. On the other hand, we have other measures like recruiting part-time doctors and some doctors. And we will also give priority to certain special services, and we hope that for Hong Kong students studying medicine abroad, we encourage them to come back to practice in Hong Kong. We will facilitate them in taking exams, and in future we'll also increase places for the medical college. Next, Dr. Priscilla Leung. Children are the future of Hong Kong, so I welcome the administration in submitting the proposal to LegCo. During the last term, on the 4th of July, I asked a question in LegCo. The administration gave a very clear reply. The background of my question then was that there were concerns about babies born to non-local parents, and the numbers had been increasing over the past few years. Be it whatever type of babies they are, they should be treated equally as long as they are permanent residents. We should not distinguish who are local or non-local babies. Some of them might be growing up on the mainland. Anyway, against this backdrop, the situation today is somewhat different. After the implementation of the zero quota system, I have heard comments that actually for the obstetric services, the demand is dropping drastically. So in the future, the situation and the number might be on the decline. Just now, Secretary was responding to our questions against the backdrop of increase in demand. But after implementation of the zero quota system, in relation to training for doctors in CEP, will you closely monitor the market situation? Actually, I'm happy with your answer. I understand that you say that you are going to consider demographic changes, but then the situation seems to be reversing. During the last term, your reply on the 4th of July to me was that you would gauge the manpower in different specialties. Can you provide more information, Secretary? As I mentioned just now, the steering committee on manpower planning in the healthcare sector, we commissioned the Hong Kong U to devise an assessment tool exactly for this purpose. The population and the demographic characteristics of a place changes constantly. This could be due to a number of factors. For example, the number of school-age children might change constantly. So we need this flexible tool for us to make assessment. Zero quota system is also a response to the concern that our service capacity might not be able to meet the demands from these babies born to non-local parents. And after implementation of the zero quota, we see that the number has been dropping. Still, it just relieved the situation. It won't cause a surplus in manpower. We also need to look at whether there are any further changes to the population.
No follow-up. Mr. Albert Ho, and then I will ask questions last. Now, my questions are not very professional. Why age 18? Now, someone 15 or 16 is very much close to an adult, being an adult. Mr. Ho? Now, well, maybe there was too little caseload, so they raised the age. Now, for NICU, someone 18 won't be there, right? Now, NICU is for newborn babies, so whether we draw the line or at 15, 16, or 18, it doesn't affect that. NICU is for newborn babies. But if we have to, how about PICU? Now, that's for all pediatric needs. Pediatrics are not 18, right, Dr. Lee? PICU? Now, that's a standard cutoff internationally, 18. Now, in our age, the line was at 12, and then it became 15, and now 18 is the international cutoff between children and youth. Now, we're not talking about physical attributes, but psychological. Someone 15 or 16 is closer psychologically to a child. Now, as for PICU, now in principle, it's up to 18, but for some hospitals, they don't have sufficient hospital beds. So in those cases, they draw the line at 15 or 16. But if we have sufficient resources, 18 would be more appropriate. For the scale of this center, now it's a very specialized hospital, right? It is not one for comprehensive services. It's quite specialized. Now, for Western Kowloon, would it integrate with other medical services? Or is there just one such hospital? Now, I will attempt to answer that. This is a unique center. Now, I don't know if I surmise correctly. Now, for a CEP, it cannot be just pediatrics. It has to have other support services. For instance, radiology or anesthetics. Now, if we have if we put a high number of children's cancer cases there, then the oncology specialty would have to be there. And now, on what the chairman mentioned, now we're not talking just about children's radiology or whatever. So there would be some liver or organ specialists. Now, some are specialists on hearts or liver cases and other organs. Now they may not be specialized there may not be stationed there all the time. Now, when there's a complex liver organ case, would the surgery be done at the center, or would the patient go to another hospital for surgery? Now it's quite complex. When one is 18, it's very close to being an adult. Now you have a specialty hospital for that. It's rather strange. Well, I will explain to you on some other occasion when we have more time. I have 3 questions. First, why is the administration under Kowloon Central Cluster? So the funding would go to Kowloon Central Cluster first, and then that cluster will allocate the money. Already Kowloon Central Cluster is the richest cluster. Now, in future, you said in Kai Tak there will be a full-service hospital. So why don't you give this hospital to Kowloon East Cluster, which has the least resources? Now, this is a public hospital. Now, many people in Hong Kong purchased insurance for their children, so have I. Now, for specialists from the private sector or from abroad, they can come and offer service. Now, I'm in surgery myself. Now, I consider those most experienced in the 70s, according to the HA system, they have to retire at 50 or 60, so they had to go to the private sector. Now, if we want to get them back to do the surgery, can this center make the arrangement? Now, they will charge a private sector price. Now, this may happen for other specialties too. Now, some specialists retire from the HA in their 50s, but they will still be in practice in the private sector, and they are very experienced. My third question is that it will provide for medical research. Now, it seems that you are providing only the hardware. There will be some meeting rooms, lecture rooms. Now, for medical research, it takes a lot of money. Now, if you simply place this under the HA, will there be additional funding for the center from the HA for research? Now, I will ask Dr. Cheung to speak on this first. Now, why Kowloon Central? Now, Mr. Ho asked, will there be a hospital next to it? Now, we are studying whether there would be a full-service hospital next to the CEP. Now, for that general service hospital, now it will take patients from nearby Kowloon City, Wong Hai Sin, etc. So there has to be a cluster to do the administration. Now, for now, we hope that the Kowloon Central Cluster can take care of that for this hospital, but we haven't gone to the details yet. Now, for this hospital, will it have independent funding, or will the funding go through the cluster first? And will there be additional funding? So we need to explore that. So I believe it will be relatively independent in its finances. Now, on private doctors, maybe they are former employee of the HA. Now, we welcome them. Now, as mentioned earlier, there's a question. Now, those patients who have purchased insurance cover, they hope they can choose their patients. Now, at this center, will they be able to choose their doctor? Now, according to the existing system, now, private patients in the public system can choose their doctor. Now, the specialists in private practice can participate in the capacity of a part-time doctor or a consultant doctor. So this is under the existing system. Now, will there be a different development in the future? Now, we are open on that. Now, on research funding. Now, just now, we talked about hardware. Now, there is 10.7. Now, for the research funding, now we understand that will be a scientific research fund from the Bureau who can provide, which it can provide funding. Dr. Kokaki, now we should support the CEP, but two facts must be looked at. Now, the CEP resources are from the same pie. Now, about 1 to 2 decades ago, the birth rates fell and the utilization of hospital beds has fallen for pediatrics. Now, in many children's specialty wards, it's just one ward. The patients go in and then come out the same day. Now, this center now for QE, it has 195 beds, Kwong Wah less than 200, and United, maybe you add that as well. Now, right now you have so many beds. Now, in future, whether at QE or Kwong Wah, will they still offer hospital beds, and how will you share the manpower? I am worried that there will never be enough manpower. Now, there may be a CEP, but at other specialty wards or clinics, the disadvantaged patients like the elderly, the psychological patients, they can't voice their own needs. Now, right now, you see that for these people who can't speak for themselves, it's very crowded, the conditions, but not for children. Now, for children's specialists, pediatric specialists, now I understand that it's difficult to reach an agreement with the two universities and consultant doctors. Now, will the two universities have come to some sort of an agreement? Now, otherwise, each will cling to its own sphere, and the other centers will allocate some manpower to it as they wish. So in the future, it will be an orphan. Now, I have some experience that I can quote from. Now, I don't want public money to be spent this way, so it's neither, so that it can be neither here nor there. So I hope it will be streamlined, so that the 13 billion is a good value for money. Now, if it's each center for itself, then I think there will be a problem. The handicapped, the elderly, they don't have so much money. Now, I agreed with Dr. Kwok. It's a real problem. Now, has understanding or agreement been reached? It's starting. Now, since I came into office, there have been many pediatric specialists at different hospitals and universities. They tell me they support our approach. Now, they all share the ideal, and the members may not think that ideals are enough, but I think this is a good starting point, so that people try to work together to achieve excellence for pediatrics in a good environment. So I think this will be a good foundation or basis for something that's difficult to achieve. Now, he hasn't given some figures. Now, I'm asking whether there would be reduction in pediatric beds at other hospitals. Now, in principle, at each cluster, they will rethink which services would be affected, which patients will be redirected to the CEP, and in that case, the resources would have to come to the CEP too. Yes?
Mr. Albert Chan, I feel uneasy about this name or title of the hospital. It's Center of Excellence in Pediatrics. I understand that the whole concept is about a hospital that provides the pediatric services to highest level. But it seems that other hospitals or organizations may not be happy about it from the point of public administration. I think that this will make others look bad, and I think it's not good. I think it should be called Children's Hospital. Yes, I think I feel uneasy about this name, Center of Excellence in Pediatrics. I hope the administration and the secretary could reconsider that. You shouldn't just boast about one hospital and make others look bad, Secretary. Actually, Mr. Chan's concern is also a concern of many members of the community. Originally, the aim of the title is to reflect the functions of the hospital. But there are two sides of the coin. Some may say that if I don't work in this Center of Excellence, does it mean that I'm not excellent? And in fact, there are pediatric specialists and doctors working in other hospitals that whom can take part in the center's work. Well, but since you raised this point, I don't mind keeping an open mind. I will ask the steering committee to adopt a more modest name or a more neutral name. I really keep an open mind on this point. Second round, Dr. Fernando Zhang, please speed up. Our time is running short. All right, I'll be quick. Secretary talked about commitment. If we look at history, let's not call this Center of Excellence in Pediatrics. Let's call it the Children's Hospital. The commitment actually comes from outside the HA. It comes from outside the bureaucracy. The commitment and dedication are from people who care about pediatric services. Now this hospital is being put under HA, and whether this commitment and dedication can sustain is really doubtful. My question just now was about the destruction of commitment and dedication if this CEP is put under the Kowloon Central Cluster of HA, because they will be competing. It will be competing for resources with other hospitals. Now, I have a number of questions. First of all, it should be operated independent of HA. There should be an independent governing body so that there won't be competition of resources. Secondly, if you want public-private collaboration, there must be representatives from the private sector. Third point, if this is a home-like, children-friendly environment, there should be under the system something that can represent the voices of children and parents. Otherwise, you won't be able to do that. Maybe I'll defer to PS to take your question. Thank you, Dr. Zhang, for your question. Now, we have all along been considering all the issues that you've raised just now. If this is to operate out of or independent of HA, on the face of it, it seems to be operating independently, but there are interface problems. Say, for example, drug procurement and referrals from other hospitals. In terms of case management, we do see the need to put it under HA. On the other hand, it is important to maintain its independence. The member suggested setting up an independent governing body. So our idea is that in terms of administrative support, this is the reason why it has to be placed within the cluster of HA. But in terms of the governing body, the board of directors, needless to say, they will be independent. There will be representatives from the 2 universities and from the professional medical sector, and also from medical research sector. It will be a very special and independent governing body, so that independence can be guaranteed. Administratively, it may be put under HA, but in terms of actual operation, it can enjoy independence, which is the aim of setting up this center. We do have a committee looking into this matter. All right, thank you. Any other questions from members? Dr. Priscilla Leung would like to ask a second round, and she is the only one on the queue at the moment. All right, and Dr. Ka-lau as well. I'll draw a line here. Dr. Priscilla Leung. Chairman, I recall during the last term, we worked very hard in urging the administration to set up a children's hospital. So about the administration's response today, we are very supportive. And about the technicalities, I think the administration could look into those matters. But the principle is that we have been striving for the setting up of a children's hospital during the last term. We have been using this term, the children's hospital, since its beginning. If this can achieve a better effect, then I am also for this title. No need to respond, right? Dr. Ka-lau, I'd like to follow up on my previous question as to whether it can be successful apart from the mode of governance. Well, we all know that there are children's hospitals throughout the world, like in Boston and other places, and very often these hospitals are not governed by their governments. I agree that a new approach should be taken, especially when in Hong Kong there is no public-private collaborated hospital. So if you use the conventional way in governing or managing the hospital, you will fail, not in the sense that the hospital will collapse, but the hospital will not be able to play its role and fulfill its mission. So this is my concern. My other concern is about resources in the future. You're going to spend $13 billion MOD prices on this hospital. What about recurrent expenditure every year? This is what we're concerned about, whether resources can be allocated without affecting services from other areas. I think Dr. Zhang can provide some information, but first of all, I need to make it clear that the setting up of a hospital doesn't mean that recurrent expenditure or financial resources will be allocated on a recurrent basis. More will have to be considered. I'll defer to Dr. Zhang. We're now in 2013. It will be commissioned in 2018, and it will be commissioned in phases. initially, our planning is that there are two major components of the hospital. Existing tertiary care services will be transferred to the center, including the manpower. So basically, the operational expenses will be covered. The other component is about enhancement, for example, medical research and etc. And as mentioned just now, the universities would also have input in relation to medical research. Additional expenditure or additional allocation around 1 billion. So we need to consider how these can be phased. I don't think we can ask for more details because they have yet to finalize everything in their proposal. I think members support the hardware development, but members are also concerned about the software arrangements in the future. So I need to ask members whether you support this funding proposal. I believe you unanimously support the funding proposal. Right, so the panel supports the proposal. At an appropriate juncture, may I suggest the administration coming back to update us on matters like governance, mode of governance, or resource allocation. Next item, private hospital development. The administration's paper and the electrical brief have been circulated to members. Secretary, would you like to wait for your team to come in first? No? All right, let's start now. Secretary, please take us through the administration's paper. Thank you, Chairman. To promote the development of private hospitals, the administration has earlier on reserved 4 sites, namely in Wong Chuk Hang, Tseung Kwan O, and Tai Po and Lantau, and open tendering process was open from April to July for 2 reserve sites at Wong Chuk Hang and Tai Po in 2012, and submissions were received. And in accordance with the government source and procurement regulations, and based on the assessment system, in March this year, the assessment panel completed the assessment work of the tenders, and the Central Tender Board has also agreed to the recommendation. For Wong Chuk Hang, 3 submissions were received. Upon assessment, the GHA Hospital Limited's tender in relation to the 2 components, the land premium and service provision, the combined score was the highest, and the hospital will be named, and the cost would be $1.688 billion. And the administration also signed the agreement and conditions of sale, land grant, as well as the service deed with GHK Hospital Limited. The shareholders of that company are Singapore's Parkway Pantai Limited and Hong Kong listed NWS Holdings Limited, whereas the Li Ka-shing Faculty of Medicine of Hong Kong U is collaborating partner. Parkway Pantai Limited has experience in undertaking private healthcare operations and developments in many regions in Asia, whereas NWS Holdings Limited is an infrastructure and service enterprise with experience in public and private hospital construction projects in Hong Kong. The winning tenderer will provide service with the following service features. The hospital will commence operation within 46 months, starting from the date of signing of the agreement. 500 hospital beds were provided. 92% of the total gross floor area of the hospital will be used for clinical services. And apart from general medicine, gynecology, and other services, services in 11 other specialties will also be provided. The number of obstetric beds will be kept at no more than 3.2% of the total number of beds in the hospital, and at least 70% of inpatient bed days taken up in a year will be used for provision of services to local residents. At least 51% of inpatient bed days taken up in a year will be used for provision of services to local residents at packaged charge through standard beds. And comprehensive charging information will be made available to the public. And the hospital will endeavour to participate in hospital assessment and attain accreditation within 36 months from its commencement and operation. And we will monitor the tenderers' fulfillment of these obligations in accordance with the land grant and service deed. If the hospital fails to perform any of the terms of the deeds, the government may, having regard to the seriousness of the non-compliance, take such appropriate actions, such as requiring corrective or remedial measures be taken, requiring the hospital to pay liquidated damages for the losses, or temporarily taking partial or total control of the hospital by the government. The government may also has to terminate the service deed, which will result in co-termination of the land grant, and the government may then resume the site concerned. As for the Tai Po site, we received one tender submission, which, however, failed to fully meet the mandatory requirements set out in the tender documents. And without other tender submissions, in pursuant to the government's stores and procurement regulations, the tender for this site was cancelled. This tender exercise is a new attempt. Through various special requirements, it ensures that private hospitals will accord service priority to local residents, adopt a transparent fee charging system, and provide various specialty services so as to address local healthcare demand. We expect that upon completion of the new hospital, the overall capacity of the healthcare system in Hong Kong will be increased, enabling the public to have more choices for affordable and quality private hospital services. It will also help address the increasing demand for healthcare services and alleviate the imbalance between the public and private sectors in hospital services in Hong Kong. Overall, this tender exercise has reflected the market's interest in private hospital development. We will examine the experience gained from this exercise, review the market response, and assess the needs of the community in formulating the way forward for the future development of private hospitals and the disposal arrangement for the other 3 reserved sites. So much for my presentation, Chairman.
Those who have raised their hands, Dr. Kwok and others, 4 minutes each. There should be enough time. Dr. Kwok Ka-ki first. Now, I think the public have suffered because the private hospitals can raise their fees without limit, and last year the private hospitals try to make a lot of money from the children with non-PR parents. So there was a lot of complaint. Now, the government promised us 4 sites. Only 1 has come to fruition. Now, the promise came from the last term of the administration, and nothing was done in 7 years. And there have been these failures. So people say maybe we should get the land to build housing first to solve the housing problem. Now, that has good reason. Now, for these 3 sites, for instance, Tai Po, Lantau, and Cheung Kwan O. Now, I'm sure the Secretary may know. Now, if you look at other places in Singapore, they try to build the private hospitals in the city so that it's more convenient for residents and for tourists. So, and in the previous term, of the administration, we also said that Kowloon East, Kowloon West, with the high-speed rail approach, and now, so these sites are available, and yet you are identifying these remote sites with bad odors and so far out in the Lantau area. So I wonder if anyone will go there. Now, will the tourists come if we embark on medical tourism? Now we leave this to the Hong Kong University. Now the HKU already has its own private patients. It has its own hospital in Shenzhen. So the professors are already too busy handling the private cases. They can make a lot of money. Those patients without money suffer. The government says that it will work with the universities. The government and the HA have to ensure that the public in different areas of the territory, including New Territories West, now these professors get 100% salaries and yet they spend their time on the private patients. Now, is this a bad deal for the public? Is the government ignoring it? Now, there are two issues. Now, at the next stage, do we need to find other land for private hospitals? And what will we do with the existing sites? Now, we must pause right now and see how the private hospitals are expanding. And some groups have already proposed new private hospitals. Now, I must say that these are proposals. Some are existing proposals. Some are still merely being proposed. Now, on the expansion and redevelopment of existing private hospitals, for instance, the Baptist Hospital, it said that in 2016 they will have an additional 100 beds. Kwong Hospital in Chun On, it said that in 2017 they will have 450 new beds. St. Paul's Hospital in 2015, 130 new beds commissioned. And Hong Kong Hospital and Sanatorium, they recently endorsed some procedures so that there will be a new building on the existing site which will add 350 beds. Now, these are the known expansions. Now, some other groups are proposing other new private hospitals. For instance, Chinese University on one of their own sites near University Station, they are proposing to build a hospital of 500 beds. Now, Hong Kong Rehabilitation Society is proposing that in Lam Tin at the Lady Trench Rehabilitation Center, they will build a private hospital of over 400 beds, and a private company is proposing that at Clearwater Bay Road, at a site owned by them, they will build a hospital of 230 odd beds. And the Anglican Church is also considering to build at its hospital site in Central to build a new hospital of 300 beds. And it's also being proposed that there will be some other hospital of over 400 beds. Now, and also there are proposals for hospitals offering Chinese medicine services. So we have to assess how likely they are. If all these proposals come to be realized, now it's not a small number. Due to the time constraint, I think you have made yourself very clear already. Now, on the second question, we'll wait till the next round. Dr. Joseph Lee, now the Secretary has talked about many proposals for private beds. Now, that's good. Now, so for the Chok Wan O and Lantau sites, will you put them out for tendering again? Now, the typo, the one that doesn't meet the requirements, Now for the Wong Chuk Hang site, there are 9 special clauses. Now, for instance, the typo site is again offered for tender, and the Lantau and Chuk Wan Lo sites are also offered for tender. Now, will those 9 clauses be the new specified criteria? Now, will there be specified uses? They must build hospital. If they don't build hospital, they must return the site. They cannot build housing on it. So this will safeguard the interests of the public. On your last question, now in the land sale deed, land grant, we already pointed out clearly that the land is to be used for the specified, the land is to be used for the specified purpose and not for anything else. As for the other 3 sites, we will not put them out for tender in the near future. We have to examine or review our tendering experience, what's the demand in the market, and given all the current proposals there are, how likely they will be realized, and only then will we decide on the use for the other 3 sites. Now, in that case, will people think that these 3 sites, despite their being remote, they may be used for building housing? Now, the Secretary has to come back to us in the future on a regular basis and inform us about these new proposals of new hospitals or expansions. Now, can we use those beds, and how about the manpower? And after you reach a balance, and if possible, will these 3 sites be returned to the government for other uses? Now, if we are going to expand the capacity of private hospitals in the future, we must consider market demand. There are so many hospitals, will there be enough? And also, will we have sufficient manpower? Now, these are the questions that we must look at first. We must look at the existing expansion plans and the plans for new hospitals, how feasible they are, how likely they are to succeed. And before we reoffer those 3 sites, we have to also consider whether these sites would be needed by our public hospitals. Next, Ms. Wong. Now, concerning the land, does the Secretary mean that they will be reserved firstly for medical use rather than for housing? The second question on paragraph 9E of the document. Now, the number of obstetric beds will be kept at no more than 3.2% of the total, that is 16 beds. Is that after the zero quota for non-permanent resident parents? And also 9F and G, I don't quite understand them because there seems to be some discrepancy. Now, there would be at least 70% of patient bed days taken up in a year. Would that be used for provision of services to local residents, or would it be the 51% as stated in G? So is it 70% or 51%? And also, paragraph 11, you said there is only 1 bid for the typo site, and that tender submission failed. Now, why is it that there are few bids, and why is it that the bid doesn't meet your requirements? Now, is it that the private hospitals think that your terms are too tough and they can't make much money. Now, on the other 3 sites, whether priority would be given to medical use. Now, as I said, we would first assess the expansion of existing hospitals and the proposals for new ones. And if there's no demand from private sector, we will look at the demand from public sector. Of course, the government has overall considerations, but the Policy Bureau's assessment would be taken into account first and foremost. Now, why so few obstetric beds? Now, this is proposed by the successful bidder. Now, initially we asked for more obstetric beds. Now, maybe they took into account the 0 quota for babies of non-permanent resident parents. Now, 70% and 51% are different. 70% of the service volume would be offered to local residents first, and then the other 51%, now this is regarding the packaged regarding the package charge arrangement. Now, for local residents, they will take up at least 70% of the capacity, and 51% would be paying package charges. Now, as for why so little interest in Tai Po?
Now we cannot really know the considerations behind the tenderers. Commercial profit may be a consideration, but location may also be another consideration. Next, Mr. Chen Han-bang. Thank you, Chairman. I see this hospital in Wong Chuk Hang, priority will be accorded to local residents. And I'm happy to see that we have Hong Kong land for Hong Kong people. We also have Hong Kong hospitals for Hong Kong people, so it's good. But according to the terms, I haven't seen any beds being reserved for use by local residents at a low charging rate. I don't seem to see this term for this hospital. And for the hospital, for the bed in those 11 hospitals, well, the administration has been criticized for not publicizing the service. So will referral be made so that the hospital beds will not be wasted? Secretary, in response to Mr. Chan's first question, in our previous land grant conditions, we have included this condition of beds charging at a low rate, but there are operational difficulties. So we're seeing this situation where some hospitals are not offering these beds, but the administration looks at this matter from quite a different perspective. Through the tendering exercise, by including these terms and conditions, the interest of Hong Kong residents can be safeguarded, so priority will be accorded to local residents. And at the same time, about the charging information, this will be made transparent. We've included different terms and conditions. It's just a matter of perspective. As for the 11 private hospitals, not all of the hospitals have this kind of conditions. Requesting the provision of low fee beds, and the administration is following on this matter. What about referral mechanism? Strictly speaking, it has nothing to do with this proposed private hospital. It has to do with the existing private hospitals. But we will not rule out this possibility in coming up with viable ways. Now, in relation to package charge, the package could be expensive, it could be cheap, it could be as expensive as itemized charges. So will there be appropriate monitoring? Now, on different occasions, I have made this point. The administration doesn't have any policy on controlling the fees and charges of private hospitals. In the past, well, different views have been expressed, but the majority view is that in terms of transparency and in terms of budgeting, well, there's not much room. In fact, you need to have all the information in order to make an informed choice of hospitals, and one of the factor that can help you make an informed choice is transparency of charging information, and we'll make an effort in relation to that. Mr. Poon Siu Ping, land is valuable resources in Hong Kong. We use land to develop private hospital. Of course, we hope Hong Kong people can benefit from it. Secretary has said a number of times that charging information should be made transparent. Now, on enhancing transparency, according to the paper, affordable and quality services are to be provided to the public. So if you have no supervision mechanism, even if you enhance the transparency of charging information, this private hospital will only benefit the rich. One other point on manpower, I'd like to know more about it. With public-private collaboration in the hospital development, how can you balance the manpower between public and private hospital? There would be brain drain, according to news reports, in public hospitals. So how can you ensure sufficient and quality doctors in public hospitals? Secretary, on fees and charges, basically, private hospitals offer a choice for our local people. So as long as we ensure sufficient competition and sufficient transparency, the market mechanism will play its role in keeping the fees and charges within a reasonable range. And we therefore need to ensure that charging information is transparent so that our people can gauge how much they might be spending on the services. Of course, for emergency services, it might be harder for one to estimate the fees because you might not yet know about your condition and what services you require. But in terms of choices, if you have all the information about the days you're going to spend in the hospital, what operation you're going through, then you can have transparency. On the other hand, there is also a question of sufficient supply to meet the demand. And therefore, we are going to gradually increase the number of beds so as to encourage competition. And at the same time, we're going to enhance the transparency of charging information so that our people can make informed choices. But you're right in saying the competition, that there will be competition of between private and public hospitals for doctors. So we need to come up with a mechanism that will include all the factors for consideration, including the extension of private hospitals, the changes in our demographic and in population, and changes in local diseases and health, public health, etc., so as to come up with a more accurate estimation for our manpower needs. Next, Ms. Alice Mack. Now, my points are actually similar to the points raised by previous members. Last year, I asked Secretary about private hospitals. I asked whether there could be a middle-class hospitals, so to speak, so that middle-class families may resort to services from such a hospital without the need to go to a public hospital or to go to, say, a hospital for the rich. But according to the Secretary, if there is no mechanism to control their fees and charges, it's not possible to have a middle-class hospital in Hong Kong. So in relation to charging, can the administration tell me whether there will be, say, inspections, etc., to monitor the fees and charges? And in relation to the service deed, I hope that things will improve in the future. At present, there is an impression among members of the public that public hospitals are not doing that well. But in fact, the incidents or blunders in private hospitals are actually not less serious than public hospitals. And these problems are left unresolved. So in relation to the service deed, can you impose conditions in relation to reporting of sentinel events, and that the Department of Health should be notified, and whether deaths are involved? Secretary. Now, about the concept of hospital for the middle class, in the election platform of the incumbent chief executive, the idea was first floated. And in this time of government, we have expressed that the new private hospital should aim at the middle class, and that is, we want to attract the middle class to get away from the public hospital queue. Now, for this winning tenderer, we know that the background is quite different. During the last term of government, there was a concept of healthcare as an industry, so it's kind of transitional concept. And we are going to review the extension projects of existing private hospitals, and also one proposed private hospital. And you can see that they are of a similar nature. For example, for the proposed project, or the project proposed by the Chinese University, the nature may be different. For Shen Kong Wu and the Hong Kong Tuberculosis, Chest and Heart Diseases Association, they're more of a voluntary nature. As per the chief executive's election manifesto, we hope that for these hospitals led by tertiary institutes or NGOs, they could aim at serving the middle class. And for service deeds will be entered into with the private hospitals for our supervision purpose or monitoring purpose. And the steering committee will also review whether there is a need to amend CAP 165 to enhance the roles and functions of Department of Health. Next, Dr. Fernando Zhang. Development of private hospitals. On this topic, basically, the Labour Party is against it. About the imbalance between the public and private sector, this is misleading. Close to 50% of healthcare expenses come from the public's money, the other half from our own citizens' pockets. Undoubtedly, public hospitals it's a major source of public healthcare service. We think that those services should be provided at the public's expense. About this site in Wong Chuk Hang, the cost is estimated to be 1.688 billion. All right, so it's 1.6 billion. The foreign partner is a business organization. NWS Holdings Limited is also a business organization. So they're making a profit. They will make sure that their investment return will be several times their capital, and this will definitely push up the fees for healthcare services. It will definitely compete with public hospitals for manpower, and this will definitely have a negative impact on the quality of public healthcare service. We are concerned that if this goes further down, only the rich will be able to afford such healthcare service. We're concerned in the future that without proper checks and balances or without proper monitoring, the hospital authority might not be able to maintain the current level of service. And about this company, I see from their website that between 2013 and 2016, they're going to develop 7 private hospitals. They are developing hospitals at great speed. My concern is that, first of all, undoubtedly they are doing business. They are profit-oriented. Now, if it encounters financial difficulties, or if there are problems with the fees and charges, or even medical ethics, I wonder if the administration could monitor that. The administration said that it has been doing a proper job, but even for charitable organizations running private hospitals at the moment, there are problems already. How can you ensure that this private hospital being run by a business organization can be properly monitored? Secretary.
No, of course, we must take care of the balance between the public and private sector in the longer term. We must not overemphasize the development of the private sector. So I can tell you that the strategy of the current administration is to ensure long-term development. So for this private hospital, there are new proposals. At the same time, in the public hospital system, we have many development plans to meet local needs. As for regulation and monitoring, as I said earlier, we would enhance monitoring regarding the sales and land sales deed and service deed. Now, even if there is progress for our public hospital sector, now who will be able to afford this private hospital? I'm afraid that there will be a polarized development. I have 2 questions of my own. The bid is 1.688 billion. Now, compared to 60 million in 1982, this is very expensive. Now, ultimately, the public will have to pay. Now, will this be a reference case for the future additional premium for private hospitals in the future? Now, also in paragraph 12, it says that if this hospital cannot fulfill its obligations under the deeds, it will be asked to pay to compensate for the losses. Now, how do you compensate? How do you calculate the losses? Now, if they can't fulfill the obligations under the deed, it's the patients who will lose. How do you repay the patients? And also about the package charge. Now, a few years ago when we talked about package charge, people get the impression that it's all-inclusive service. Now, at the time I said that the service cannot be all-inclusive, but you can stipulate certain items. For instance, say appendicitis, the package charge is 40,000, 5 days in hospital, 2 hours surgery theater, and tests, care, and food. So these are the standard hospital services. It's a package charge. Now suppose the patient has to go into intensive care unit, it's not included, they have to pay extra. So does that meet the requirements of being a package for which there's a package charge? First, the permanent secretary can discuss this issue first, and then I can supplement. The third question, yes, I will try to answer that. On the land premium and the package charge, how do you compensate for the government's loss? If a private hospital seeks profit and uses government land, of course they have to pay additional premium, and the government will consider the market price. For instance, what's the location and where the hospital was before, so the government will consider the price in this case, and they will consider the new location. So you leave this to the surveyors. Well, they will certainly be able to tell you, yes, say they will take into account the location such as Clearwater Bay and the size. Now also on the compensation of loss, we applied the liquidated damages concept. Now very often that's in the construction industry. If you are late by a certain number of days, you have to pay so much. Now, and that's the case abroad. Now, right now, when you grant land to private hospitals, sometimes you have difficulty because in the end you have to get, you have no way to get the compensation. So we ask them to reach, say, 70% for of capacity for local residents, or 51% to be on package basis. Now, if they cannot attain the 51%, then they will be fined. And the fine is not just for just being the compensation. That is, if they do not correct the mistake, eventually they will the government will resume the land. Can you supply us with the formula? I will try. It's not to compensate the patients. It's written into the clauses, and they fully understand how it works. Now, as for package charge, we are familiar with that. It has to be all-inclusive, and they have to specific what constitutes all-inclusiveness, what illnesses, what's the amount. Now, this is a new concept. So please answer the question. Now, if the package charge doesn't stipulate ICU service and the patient needs ICU service, in that case, is it included? Now, very often, if you go to a restaurant and you order a package, they will stipulate what costs are involved. Yes, we are two clauses. One clause is that 51% will relate to the package charge. Now, my question is, there will be many such cases. Now, there must be a definition of the package. Now, if the patient uses service other than those stated in the package, then they will have to pay extra. In that case, do they meet the stipulations in the deed? Does the patient have to pay extra in addition to the package charge? Chairman, I understand your question. You are right to a certain extent. They must stipulate the components of the package. So we will look at that. Now, if the service is very different from those usually required for appendicitis, and if and we also look at the level of the charge. Now, on what's not included in the package, theoretically, the patient would have to pay additional. Now, does that meet our principle? We have to look at it. If they stipulate everything and then anything other than that, they will charge. So we will look at that. Now, Mr. Vincent Fang first, and then perhaps you can explain further. Mr. Fang. Now, I'm also very concerned about the package charge. Now, as the chairman said, the package must stipulate what's included, what are the services included. Now, if suddenly the patient has to be taken into the ICU, now this is unfortunate, but it's not anticipated. So we do need package charges. Now, for some private hospitals, the problem is the patient is admitted, but they don't know how much they have to pay, because sometimes the private doctor visits you in the morning and visits you at night, and they charge a lot. So the people are afraid to go to private hospitals because of the high charges. Now, for public hospitals, now the quality of service has been raised a lot. Now, the public is concerned that in the past few years, the government gave a lot of money to the hospital authority. The public hospitals have enough for hardware. The problem is with the software. It's very bad. There is a great deficiency of doctors. So I'd like to ask, in the next few years, you have all the hardware, new equipment, but there's no one running them. For instance, the Lantau site offered, you have to get people from other hospitals, so that will reduce the level of service at other hospitals. So the key issue is the manpower in terms of the number of doctors. Also, it's been said that the private hospitals offer some better services, but I must say something also for the public sector. Now, for some difficult and complex cases, the private hospitals don't handle them. They push them all to the public hospitals. So there are more medical incidents at the public hospitals. So we must note that. So to provide a suitable level of service, can the Secretary tell me how you will enhance the number of doctors Otherwise, the level of service will decline. Now, I think we are all aware of the tight manpower situation. Now, in the past few years, the HA has taken several steps. Firstly, it tries to get the doctors to stay by all the means they can. Secondly, they get part-time doctors, and then we talk to the medical council for the number of exams per year is not just once a year but twice a year, so more doctors trained overseas can come back and serve. So every year there are new doctors joining our ranks, and we are very careful in allocating these doctors to different departments based on the existing shortages. Now, for those with greater shortages, we will allocate them new doctors in priority, and so the number of doctors has increased by 100. Well, we need to increase the length of the time of this meeting by 15 minutes. Dr. Fernando Chow.
2 questions. One on manpower shortage. Brain drain is inevitable. Now there is already a shortage of manpower. In the future, private hospitals will be competing for doctors, and my question for the Food and Health Bureau is, in terms of manpower planning, what do you have in mind? And this land grant is for a tenancy 50 years. What about the service deed? Is it similarly 50 years? And when will there be an interim review, or when can a review be conducted for any possible amendments proposed by either side? Secretary, on manpower, let me explain once again. For long-term manpower planning, we do have a steering committee, and there is a tool available for us to consider the long-term development needs of public and private hospitals and demographic changes in assessing manpower needs. On approving private hospitals' plans for extension, we have been very prudent. We have tendered out 2 sites, but the result of the tender is that one tenderer who have fulfilled all the requirements won the bid, whereas for the other site, it was held back. And as I said, we need to strike a balance between the development of private and public sector, and we need to gauge the number of beds. As for service deed, I'll defer to Permanent Secretary to say a bit more. Chairman, Dr. Zhang, first of all, we need to understand that this is not an allocation of site without payment of land premium. This is in accordance with the market tendering mechanism. So the service deed also has a tenancy of 50 years along with the land grant. And if the performance is very poor, the government has the right to terminate the land grant and the service deed. So the service deed is cannot be changed. Chairman, may I supplement? In the service deed, it has been stipulated that apart from fulfilling or complying with all the conditions in the land grant and the service deed, the tenderer is also required to comply with all the existing laws and regulations prevalent at the time, and in relation to Cap 165, they are required to comply with all the provisions on regulation of private hospitals. Can I follow up? Briefly, That is to say, now there could be an outbreak. I don't know whether we will face similar situations when this hospital is commissioned. And the private hospital should also have this obligation to combat any possible outbreak or pandemics. So far, we have not included this in any of our conditions. However, for our emergency plan, the hospital authority is of a scale 10 times larger than a private hospital. So we will adjust our service to cope with the situation. And there are far more experts in public hospitals and private hospitals. So on disease control, we basically rely on the public healthcare system or public hospitals. For private hospitals, our requirement is that suspected cases meeting our criteria should be referred to public hospitals. Okay, one more follow-up question. Packaged service. It seems that you don't have the details yet. As mentioned by Secretary just now, as long as the package is set at a reasonable rate, under reasonable circumstances, there could be itemized charges for individual services, and this can still meet the conditions under the service deed. So yes, in the view of the administration, if it's reasonable, then it can be allowed. But we will look at whether it's outrageous. We're not talking about unreasonableness. Let's say if it's reasonable, it can still meet the service deed. Let me repeat. In principle, package service, if you talk about particular surgery, a particular condition, basically everything should be covered. However, I cannot exclude any possibility in which one may reasonably think that the item should fall outside the scope of the package, but I cannot cite all the examples now. All right, so we've asked many questions and time is up. Thank you, members. Thank you, Secretary.